Hello, lovely viewers. Welcome to the maiden edition of Femaffair with me, your host, Aba FAME. This program is designed to help women live in purpose, physically, mentally, emotionally, and psychologically. This program is also designed to help deal with a lot of myths concerning womanhood. Today's topic is on maternal mortality. Do you know maternal mortality goes beyond a woman just dying at the labor ward? Well, your guess is as good as mine. So before we go for a quick breather, I would like to acknowledge my sponsors. Furniture City is behind this beautiful edifice you see. Enyos Blend did my makeup. Biokima Clothing is in charge of my closet. Then GH Media took charge of the production. We'll see you in a bit. Stay tuned. You must discover your worth and purpose as a woman to be valuable and successful in life. This means that as a woman, know what you stand for so you can progress in life and know where to be at the right time, doing the right thing with the right people. If you just tuned in, you're watching Femaffair with me, your host, Aba FAME. As I said earlier, we are dealing with maternal mortality today. And right next to me is Dr. Vanessa Mensah Kabu, a woman I admire so much. Welcome, Doctor.
Thank you, Aba.
Okay. And next to her is our midwife for the day. Her name is Mrs. Eunice Afuakwa. Welcome, Auntie Eunice.
Thank you.
Okay, so let's just move on quick to the topic we have for today. There's one topic that's so dear to my heart because most times we hear stories about it and it's so amazing that people lack knowledge about it. So first of all, to you, Dr. Vanessa, what is maternal mortality?
Well, thank you, Aba. Maternal mortality basically is the death of a woman while pregnant or within 42 hours, after termination of a pregnancy, irrespective of the cause of the pregnancy.
Okay.
Yes.
Oh, wow.
In summary,
oh,
yes.
Wow. I see. So it's not all about a woman dying at the labor ward as we
Not at all.
So if someone dies as a result of an abortion, is also...
It is included as a maternal mortality.
I see. Personally, I never knew that. But let me come to you, Mrs. Afuakwa, our midwife for the day. I'm sure you are the labor ward. There's a lot to say when it comes to these things. So can you share with us some of the causes of maternal mortality?
We have so many causes, but some of our major causes are hemorrhage, that is bleeding, sepsis.
Wow.
I mean, when we see sepsis, infection, you know, when we say the causes, we can group them to direct and indirect. Okay. But when we talk of the hemorrhage, the sepsis, and sometimes mismanagement, these are some of the direct causes. And we have indirect causes like pre-existing medical condition, like the person is having maybe cardio problems, malaria, and other medical condition. Those are not direct cause, let's say accident or incidental. But when it comes to hemorrhage, sepsis, mismanagement, they are the direct cause as far as maternal mortality is concerned.
Wow, I see. Dr. Vanessa, I would like to ask, is our healthcare system in Ghana a cause, a factor in maternal mortality in Ghana?
Well, like my dear colleague said, we have some indirect causes of maternal mortality, and sometimes the healthcare system also does play a role in maternal mortality. Yes, there is indeed more to maternal mortality than meets the eye, and like you rightly put, it's something that has been undermined until it is so close to you, such as maybe a relative has died or has gone through labor or after pregnancy has happened to die. Our healthcare system can do much more than it is doing, although we're doing the best that we can with whatever it is that we have available. So we have, for instance, maybe a patient comes in and we need to rush the patient into theater, and maybe there aren't available equipments to aid in the delivery of that child. And unfortunately, the mother dies. That is an indirect cause that leads to maternal mortality.
I see. What are some of the causes that comes with the mothers that are outside that causes maternal mortality?
Sometimes these mothers comes with superstition.
I see.
The things that they are supposed to do, they come and it's like, from where I'm coming from, I'm not supposed to be operated. That is when we talk of cesarean section.
Yeah.
My pastor says I have to deliver per vaginum.
Oh.
So even though the baby is big or sometimes malpresentation that she needs to be operated, because of what she has been told, she holds that belief that she's not supposed to take medical advice.
I see.
Sometimes they default. They will not come. You booked her for cesarean session, come for induction, and they will not come. Some will come and they will tell you, I don't take blood. Even the person has bled to the last, some are taking HB of 3, 4, and they will tell you, my church, religious. You can't go by somebody's beliefs. So you cancel the person, okay, we are coming, we are doing this. Sometimes you have to force them. And if the person doesn't give you the go-ahead,
you can't do
by
nothing.
the time they sign in with their consent form, the worst thing has already happened. Somewhere around last year, May, we had a client who had already delivered twins. She had, let me say, she's para 4. When we say para 4, she has already delivered 4 times.
Wow.
So the 5th one, it was a big baby, and she has post-dated. The normal time for delivery, which is the 40 weeks, is past.
I see.
So we booked her for cesarean session, giving her dates. Fortunately for her, the husband was traveling. So the husband, according to the husband, he left some money. But he said at the cost about a week, she said, my wife has not given me any update as to whether she has delivered or not. I don't know. Let me go home and see what is happening. He came back home and the wife was still home. She hasn't delivered. So let me match her to the hospital. So the man brought this woman to the hospital. We have to treat her as emergency because the time is, far past, almost 2 weeks. So we prepared her to the theater. At the course of preparation, she said she wants to go and wee-wee. So we were even telling her, we are passing catheter, so hold on. So that she said, let me wee-wee and come so that you continue. Okay, maybe she doesn't feel comfortable. So on her way to the washroom, she shouted, midwife. We went and she was on the floor. She started vomiting.
Wow.
And we realized that this thing, it was oily. So I don't know, dog will understand me. We intubated. And we realized that this oily thing was coming. So we asked the husband, what has she taken? And the husband said, madam, you have no idea of things that are in her bag. She brought some oil, olive oil, whichever from the pasta. There we got to know that she was fasting for 3 days.
Wow, a pregnant woman?
Yes, the pastor says she will deliver. So she was fasting. And believe you me, within 30 minutes, this woman passed on with the child.
So religious beliefs has been a...
Well, it's not a bad thing to believe in God. I believe in God personally. But what needs to be done should be done. And then the God factor would take up from there. In this case that she explained, clearly then the woman needed to have a cesarean section, an elective cesarean section. But unfortunately, she fell prey to her belief and then insisted that she was going to deliver by herself. With fetal macrosomia, that is big baby. It's near, even though some people have actually pushed, it's almost near impossible to actually deliver that way. Each woman needs to understand that every pregnancy is different. Maybe your first pregnancy went this way. Your second pregnancy would not necessarily go the same way. Yes, each and every pregnancy is different.
Okay, wow. So on Femaffair with Aba Fame, we always give our men the chance to share their views on our particular topic of discussion. So we'll hit the street and get to hear what the men have to say. We will be right back.
My understanding of maternal mortality is simply, women going out for delivery and eventually, lose their babies or maybe they lose their life. You see, in our part of Africa, there are so many causes. Some or most women take the decision of, carrying out pregnancy when they have tried several abortion processes and it has failed. So you can just imagine when they keep their baby, it has already been tampered with. So anything at all can happen. Before you realize they are in their 9 months and they have taken several abortive chemicals that they think maybe could terminate the baby, and eventually they couldn't get their way through. So finally, during delivery, anything, complication can happen.
Maternal mortality, I have not experienced it before. I would describe mine as near mortality, in the sense that when my wife was due for delivery, the first child, the expected date of delivery was on the 1st February, but then on the 31st of January, she had to be rushed to the hospital because there was an excessive flow of blood when she wanted to go and urinate at night. She didn't die because I think the facility had very good facilities or equipment or things that could save her life, and because the facility had a lot of experts. We got around 12 o'clock, but by 12:15, 12:20, all the experts were called and the life of the baby was saved and the mother was also saved. I got to know that the condition was known as placenta abruptio, which should have ended the baby's life, and who knows, maybe the mother too could have died. So I think that the major cause, or one thing that can lead to maternal mortality, will be the facilities in any medical hospital and the kind of experts that are available at a particular point in time when a mother is due for delivery.
Basically, what I know about maternal mortality is when a woman passes on whilst giving birth. And in my view, I think one of the causes of maternal mortality is when a lady who is pregnant do not go to hospital for frequent antenatal treatment. And I think one of the best ways we can reduce the level of maternal mortality is when pregnant women are encouraged to visit medical facilities whenever they are pregnant.
Those were interesting views from our men. So we continue our discussion. Madam Midwife, my question to you now is, what are some of the services that are generally included in maternal mortality?
Okay, Aba. As to the mortality, we have something we call audit committee.
Oh, okay.
Whenever there is a mortality, we do auditing.
I see.
And the auditing goes beyond the facility. It's a protocol that has been laid down.
Yeah.
The first 7 days, the facility at which the mortality happened will signal the RCH, that is the public health.
Okay.
Then they will take you from there to the district, to the regional and national. Okay. But within the 7 days, the facility will sit down and have their audit, that is internal audit. Look at the causes, where it's coming from. We take it up from the antenatal, because some of the things should be preventable from the antenatal, the labor till the death occurred. Then from there, the region or the district will, inform the region, and they too will find a date and then do a regional audit. Of late, before, they used to come to your facility, do the audits over there. But they realized when they come to our facility, we were lenient and we could, so now they don't do it. They will call you at the region. Sometimes you go to RAGE, national executive will come, district, regional, and they do the audit there. Yeah. And you know, when we look at the causes, we didn't bring in hypertension, which is one of our major cause of mortality. You know, Greater Accra, somewhere last year, Dr. Akaba and other doctors tried to design their own rules and regulation, and they were having a lot of workshop all around. Yeah. Just, you know, we have a BP rate. That's when you see this woman, you treat her as hypertensive. They reduce it, that even when you see one sign, like let's say we are having 2 or 3 signs, they said even when you see one, you treat this woman as such, because, and it was helping. It was helping. And it really helped.
Pearl, what she said, I realized that she said lay down proceedings have been put in place to monitor these situations. Does it really work? And what of a situation where somebody comes and the person never attended
the antenatal,
so you don't have a detail or any details of them? Do you do follow-up?
Well, I was going to add on to what she said before you asked the question. The health system is actually doing its best.
Okay.
And now we cannot do it on our own. We need the help of the individual. I mean, it's your pregnancy. We can only do so much for you, but you also need to comply with these things that we're doing.
Yeah.
There's so much information around that. Once you find out that you are pregnant, get to a hospital, get scans done, because at the very early stages of pregnancy, who knows, it could be an ectopic pregnancy.
Yeah.
That is a pregnancy outside of the uterus, you know. So these things will be picked up immediately you start your antenatal.
Okay.
And once you find out that you're pregnant, ideally a woman is supposed to go to the hospital, seek for antenatal, but she also has to decide whether she wants to keep the pregnancy or not.
Okay.
And it's something that we are now open to. Before, there used to be some sort of stigma or some sort of discrimination with women who are pregnant but do not intend keeping the pregnancy. Any woman that has experienced pregnancy would understand that it's not anything to play with.
Yeah.
So you have to be psychologically prepared, you have to have the support and know that it's something you want to go through with. So the policies, the protocols, they are laid down in each and every clinic or hospital.
Okay.
It's up to the individual to follow through with them.
Okay.
Yeah.
So have you ever encountered a situation whereby the person had no records?
Severally.
Okay, so what do you do?
Well, at that point, you have to deal with what you have. So if a woman comes into the emergency room, she is 40 weeks pregnant.
Yeah.
You check her vitals. What do you see? You check her urine. Are there any proteins in the urine? You check her full blood count to know what her HB is like, and then you take it from there. Okay. Some women end up coming in emergencies. So there isn't, so while you're doing A, you're also doing B. You have to do it concurrently. Sure you get accurate
info to
just
work with.
to prevent any mortality of the mother or the child.
I see.
Okay, Aba, let me come in here. As to whether or not somebody comes to the hospital without antenatal records depends on the catchment area.
Okay.
When you are in a place where your people understand that they should go to hospital, you will not suffer.
Okay.
But when you are in the district where you have people around you, that's, I mean, we have people where your records is more of teenagers. I'm sorry for you.
Who are reluctant to go
relax.
for antenatal and all.
They will come in, I mean, let's say somewhere around 35 weeks, and she will tell you, how old is your pregnancy? She said 1 month.
She might even say, I'm not pregnant.
I'm not even pregnant. I've not seen my menses for some days. Some will tell you it's malaria.
I see.
Some will come fully dilated and it's like, asemi who bibi or mase, and it's a baby.
Wow.
So no call sheets, nothing. This is a stage where you cannot do full blood count at a spot. Even though you take the sample, by the time maybe it comes in, baby is already in. And if some bleeding should set in,
it will be a challenge.
It will be a challenge.
You know, we need not stigmatize teenage girls who end up getting pregnant.
Exactly.
This is because there could be several reasons why. I mean, rape could be a cause of pregnancy. And majority of the teenage pregnancies that are recorded are from rape.
Rape, yeah.
You know, so because they're already stigmatized and already feeling ashamed that they have been raped, they will not come and tell you they're pregnant. Because they would feel like, oh, you went to do bad girl things and that's why you got pregnant. So the education is very important.
So on that note, Doc, the current maternal mortality ratio?
Well, the current maternal mortality ratio, I think as of 2017, it was 390 deaths to 100,000 live births. Yes, I think that should be it. If I'm not mistaken, yeah, we would have to probably update on that.
I'm still on the teenage pregnancy issue. Some teenagers also avoid antenatal because of abuse from nurses and midwives.
Exactly.
How is this also being handled pertaining to maternal mortality?
Well, the education of staff to understand that even if
is this something that is ongoing?
Oh yes, I believe in your clinic there's education, morning meetings, education of the staff. Yes, you know, even if the person is having consensual sex with their partner and happens to get pregnant, they are entitled to care. Regardless, you are not supposed to discriminate them.
Okay.
You know, so if someone comes to you with their partner, they are not married. Yes, we're having sex. I'm here. I want to keep the baby. I am 18 years old. That's a teenager, basically. You know, but they are entitled to that consensual sex they're having with their partner. Why would you discriminate the person saying that, are you not too young? Are you not going to focus on your education? Why are you indulging in such acts? You know, it's unfair to them, because that would mean that after they have seen you for the first time, they definitely will not come back. Nobody wants to go where they would be discriminated or abused. You know, so I think the onus lies on us as healthcare professionals to be able to provide that conducive environment for our patients, irrespective of what they come with.
Okay. So on that note, we'll go for a quick commercial break. We'll be right back. Welcome back from the break. We're still continuing our discussion on maternal mortality. I still have with me here our Dr. Vanessa Mensah-Kabu and our midwife for the day, Mrs. Eunice Afuakwa. So let me start with you again with this question. What has been done to prevent maternal mortality?
When we say education, we educate the community, the mothers, staffs as well. When we say the mothers, when they come to the normal antenatal, when they come to my end, we have a routine talk that we give them education as to their diets, how they should sleep, donation, what they should expect when they come for, when they come to labor.
Okay.
We have that kind of education. And as you can see now, we have so many programs going on. When you go to our YouTube and stuff, people go to net and read about mortality and their courses, preventive measures. So they are all kind of education. Moreover, we have workshops that are being organized for staff. You know, there are certain things that we were doing before that are not being done again. And there are some too that we add up when it comes to these hypertensive protocols. It keeps on changing.
Okay.
They are all kind of workshops that they organize to, help prevent the mortality rate.
Okay, so per your submission, the auditing aspect keeps improving, helps to keep improving the maternal death we are having. So Doc, let me follow up with this question. Has this proceeding been effective?
Oh, as for the effectiveness of these protocols, education, in the urban areas like Accra, Kumasi, I would say that they seem to have it in place. They seem to have it going on well for themselves, even though it's not ideal or it's not 100%, but it has greatly improved. Yes, but now we're looking at the rural areas.
Exactly.
Education in the rural areas. How far along are we in that aspect? Because that in the rural areas is where you have majority of the teenage pregnancies, and they are the ones that have I would say the illiteracy level as compared to the urban areas is higher. So what are we doing in that regard? You know, you have to educate the mothers, you have to educate the fathers, you have to educate their family. Support is something that we tend to undermine or underestimate, especially when a woman is pregnant.
Yeah, in our parts of the world.
Exactly. The support from family goes a long way. The discrimination starts from home before it is then even taken elsewhere. If you get pregnant and you know that, hey, if I go home, my parents are going to kill me. The next thing you think of is, how am I going to terminate it without anybody knowing? And then you end up going to the quacks. And you end up with dire complications. If you do not die, which is the major one, you may end up with other complications, such as uterine perforations. You end up losing your uterus, you know, and some of them do go through the process without any complications, but then the complications are there. So as for the education is very important. So the healthcare system is doing its best with regard maternal mortality. It's left with the people to also follow
Make
suit.
It more effective.
Exactly.
By
we
playing
can't
their
do it
role.
on our own.
Yeah.
We can only do our best. I can come and tell you that if you get pregnant, come to me. But I can't guarantee that you would come to me if you get pregnant. You know?
Okay.
So it is not a crime to be pregnant. It is not a sin
matter the
to be pregnant, irrespective of the circumstances. Come to us. Our pastors, they need to do their best. I mean, we're educating our patients. That is if they come to our clinic. you have a great congregation. So if you speak to them, the men also need to support their women.
Their wives.
If you get someone pregnant and you feel you cannot take the responsibility of that pregnancy, own up to it, say it. But if you feel you can take the responsibility of that pregnancy, it means once you make that decision, there is no going back.
So you need to, since you've started, you need to finish it.
Exactly.
Yeah. It's been very educative so far with our discussion on maternal mortality. We've got into another interesting segment on our show, which is called the YOLO Women's Movement. We'll take a break to have some beauty tidbits. We'll be right back.
Hello, exciting viewers. Welcome to YOLO Tidbits. Today, we are discussing manicure. Manicure is cosmetic treatment of the nails. Sometimes it involves shaping the fingernails or adding some little color to your fingernails. Manicure is good for you. You need manicure once every month. When you take your paycheck, try and enter any of a beauty shop and have your nails manicured nicely. Benefits of manicure are you boost your self-confidence. It helps you to look clean. When you are walking around, they see that indeed you are a professional. Do manicure once every month. This segment was brought to you by YOLO Beauty Salon and Spa. We'll see you again next week. My name is Charlotte Lily Beidou.
Welcome back from our beauty tidbit from YOLO Women's Time. We're about to wrap up the show, even though we wish we could go on and on and on, but hey, whatever has a beginning has an end. So, Dr. Vanessa, what are your final words for a woman out there?
Education, education, education. Go to the hospital. It is not a crime to be pregnant. Yeah. It is not a crime to go and then seek contraception or family planning. We have a lot of it.
Sure.
There are so many ways of preventing your death. And there are so many ways of preventing complications associated with pregnancy. Yeah. So help us to help you. The services are available. It's up to you to make good use of it. Yes. We are not discriminating against you. We are here for you. Come to us so that we can help you and get the best outcome so that everything can go smoothly and we can reduce Ghana's mortality rate. Yes.
Okay. So, our midwife for the day.
Aba,
what are your final words for women out there?
They should come to the hospital, as Dr. said. And secondly, we will advise our mothers too, our second doctors at home, that whenever their wives are pregnant, they shouldn't give them their experience.
Because every woman
time
is different.
Changes.
And every pregnancy is different.
Too, you can't predict. You cannot compare the first one to the second pregnancy. So we are pleading to our pastors too. Those of the pastors who have been saying you deliver, cesarean section is not your portion, this is not your portion, please, there is time for everything. So when it comes to medical advice too, they should allow them seek medical advice. So that at the end of the day, we all live in harmony.
My final words to you is that as a woman, make sure that your life is important to you. With all that we've learned today, it boils down to you taking charge of your life to make sure that when you're pregnant, you take the necessary steps and take the medical advice that is given you, for your life is precious. All too soon, we've come to the end of the show. We've had a very powerful, educative discussion on maternal mortality today. We would like to thank our beautifully awesome ladies in the studio, Dr. Vanessa Mensah-Kabu and Mrs. Gineza Fuakwa. God bless you so much for coming on the show. We say, may every virtue that has gone out of you be replenished. And we hope that the next time we have you on the show, we'll have a testimony that maternal mortality has gone down.
Sure. Thank you too for having us.
Yeah, you're welcome. So, on that note, I would like to acknowledge our sponsors. Furniture City is in charge of our beautiful edifice. Barikima Clothing did my closet. Enyo's Blend did my face beat. And then, of course, GH Media, they are behind the production. So we'll see you next week, same time, same channel. Bye-bye.